The Southeast Idaho Health District is made up of 8 counties. Last week, 3 of those counties raised their COVID risk level from minimal to moderate. KPVI News That Works For You journalist Kate Garner takes an in-depth look at how and why that decision was made.
The county commissioners in each of the 8 counties that we serve appoints a representative to serve on the Board of Health.
During the pandemic, the Board of Health makes decisions, like raising a county from a minimal to a moderate risk level. Many of the board members come in without a background in healthcare. However, they meet monthly with Southeastern Idaho public health officials, and many also serve on local hospital boards.
And so even if they don't have a strong background in healthcare or medicine, when they come to the board, they work hard to develop an understanding of public health that enables them to make reasonable decisions.
Mann, who is the director of Southeastern Idaho Public Health, says the decisions the board makes during the pandemic are not done on a whim. Before making any decision, the board looks at active COVID cases, outbreaks, and hospital data, which includes availability of beds, staff, and resources like PPE.
Our board's approach has not been to issue any kind of mandatory order. They are changing risk levels for awareness in our communities about the level of spread of the virus. And attached to those risk levels are recommendations.
Hospitals in all 8 counties of the district report data daily. That data includes new COVID hospitalizations and the number of ICU beds in use. This means hospital needs play a role in determining a county's risk level. KPVI reached out to hospitals in all of the district's 8 counties and got responses from all but Franklin and Butte. In all the small county hospitals, there is a similarity. They are not near capacity now, but have limited staff and beds. So, their concern is one outbreak could mean exceeding capacity. And that is what all hospitals are trying to avoid.
Not that we are barely holding on by the skin of our teeth, was that, okay, now we're heading into the busiest time of the year.
Over the next few weeks, hospitals expect their annual surge in flu and respiratory patients, which would be fine if COVID wasn't around. Dr. Snell says after the state left each stage of the shutdown and as schools reopened, hospitals saw an increase in patients and then plateaued at a higher level than before.
Can you combine that coronavirus, utilization of our resources with every other utilization of our resources? We've eaten up our buffer, a lot of our buffer.
Hospitals like Portneuf work to treat everyone, but they need the public's help to slow the spread of COVID and preserve the resources they need to do that. Dr. Snell says it's pretty easy to understand why hospitals are being cautious right now.
There are more people in Southeast Idaho than there are hospital beds, right? So if everyone were sick at the same time, we wouldn't have enough beds to take care of everyone.
In Pocatello, I'm Kate Garner, KPVI, News That Works For You.
Dr. Snell says looking at only hospital capacity to determine a county's risk level would be oversimplifying the problem. Some of those smaller county hospitals we spoke with also have nursing homes attached to them, which increases the possibility of exposure for vulnerable populations. And all those hospitals we spoke with say that they support the decisions the Board of Health has made so far.